Everyone's familiar with this situation, having a prescription from the doctor filled at the pharmacy. However, where do the pharmaceuticals you receive come from? How do they reach the pharmacy? And how can the patient be sure that they're genuine? The scale and variety of medicines available is growing all the time. The complicated movements of goods that keep pharmacists stocked presents an increasingly attractive opportunity for criminals, who look to profit through selling counterfeit prescription medicines into the legitimate pharmacy supply chain. There is an alarming increase of medicinal products detected in the EU which are false representations of authorized medicines. These products usually contain substandard or false ingredients, no ingredients, or ingredients in the wrong dosage, thus posing a serious threat to human health. Each year, copies of branded pharmaceuticals put many patients at risk of serious injury or even death. Therefore, it is vital that there is a way to check the provenance of the products dispensed to reduce the risk of counterfeits. However, the reality of the pharmaceutical supply chains in Europe makes the verification of the authenticity of products very difficult. Different countries have different codification systems, and large numbers of products routinely cross borders and thus are difficult to track and trace. Therefore, the European Federation of Pharmaceutical Industries and Associations, EFPIA, is pursuing a uniform drug coding system for the whole of Europe.
The main reason for us to launch the coding project was patient safety. We became very concerned about the growing number of counterfeits entering the normal supply chain in Europe and felt that we had to take some responsibility in playing our part to address this. Two lines of action, basically. One was to support the Commission very strongly in its attempts to put in place a new legislative framework to stamp this out, and secondly, to embark on a technological solution that would be our contribution to making sure that we deal with counterfeits in Europe.
EFPIA's solution stipulates a standardized method of coding and identification. It consists of two parts. Each pack of pharmaceutical products will be encoded with an individual manufacturer's product code in the form of a two-dimensional data matrix printed directly on secondary packaging of all medicines sold in Europe. At the point of dispensing, each product will be verified by scanning the data matrix. This approach will not only reduce the risk of counterfeit products, it will also reduce the risk of dispensing errors and make product recalls simpler and more effective.
We believe that verification at the point of dispensing is the most cost-effective system for Europe because it does take account of the 27 different regulatory systems that are in place across the different member states, and it creates a flexibility taking into account the billions of medicines that are dispensed every year in Europe.
Stockholm, Sweden. Here in late 2009, EFPIA launched its pilot project to test its coding and identification solution. The project ran for 4 months in the greater Stockholm area and involved 25 retail pharmacies with a total of 180 dispensing points, 25 different products with a total of 110,000 packs, and 14 different manufacturers. The retail pharmacy chain Apoteket took part in the project. Pharmacists will be pivotal in working with the equipment and are therefore key figures in the likely success. Currently, pharmacists are heavily reliant on visual checks to make sure that medicines are not counterfeit. Under the EFPIA solution, pharmacists can identify each individual pack before it is dispensed to the patient.
The pharmacist scans the data matrix code, and a check is done with a database, which automatically tells us the status of the product. if it has been dispensed before, if it's been expired, and so on. And we get an immediate response.
Via scanning, the information contained in the data matrix is checked against the database at the manufacturer. And the pharmacist can immediately see the status of a medication.
This page shows us the EFPIA information, which is collected partly from the code and partly from the database. It holds the serial number, expiry date, and so on. And at the bottom it shows the status of the product in the database. So this one is verified and okay to sell.
Only if the product has a clear pedigree is it dispensed to the patient.
When you scan a product that is not verified, it shows no information about the product, and you also see that the product is missing in the database.
The EFPIA solution provides benefits for the patient and for the pharmacist.
The main benefits, I think, are increased security, where you can check with the database if it's an original pack. And also we have the expiry date in the code, which means we don't have to check it manually. And the system is also very easy to use and no difference to what we've done before.
Besides the pharmacy chain Apoteket, the local wholesalers Tamro and KD are important stakeholders in the project.
Scanning was an ordinary part of the dispensing process in our pharmacies, so scanning a 2D code was not a big difference compared to the way we were working already. The most important benefits are, of course, the possibility to prevent fake drugs. But from pharmacy management point of view, other benefits as well are important, like, for example, more effective stock management procedures in terms of managing stock control, withdrawals, etc.
We are pleased by the fact that we were able to integrate this new system into the pharmacy workflow. This was confirmed by a survey that we conducted to collect some feedback from the pharmacists, and they really emphasized that they were happy with the system and how it worked. And these two aspects together form the basis for us to be confident that this system can be implemented not only in Sweden, but also in other regions in Europe in the future.
What will be the next steps for the project?
In our eyes, this system provides the best opportunity for a cost-effective, harmonised and interoperable system for Europe in line with what we are seeing emerging from the EU Directive on Falsified Medicines. But it doesn't come without its challenges, and the different regulatory systems and healthcare systems that exist across member states will mean that we have to work closely with a lot of national authorities and pharmacists and other stakeholders to make this work.
The pilot project proved that EFPIA's solution is robust, reliable, fast, accurate and secure.
The pilot project was a big success on two fronts. First of all, it proved technologically that the system that we were proposing works. And secondly, it demonstrated great collaboration between the other actors in the supply chain with the industry, the pharmacists, the wholesalers and the government authorities.
The pilot project showed that EFPIA has an effective solution to fight counterfeit pharmaceuticals and thus to improve the safety of patients. Now, the next steps need to be taken to make this reality.